Welcome to the Dr. Truth Show with Dr. Michael Hall. It is Friday, the 6th of August, 2020. Speaking to you from Hall Longevity Clinic in Miami Beach, Florida. I'm here with Sophia, who is my assistant. And today she recommends that we're going to talk about cosmetic dermatologic procedures or aesthetic cosmetic procedures. You can choose either way to discuss those options. One would be through more of a dermatologic perspective, and the other, based on my experience, has been ophthalmic or ophthalmologic perspective, which is really based on eyes and around the face more so than just the skin, although my training is also in general medicine, so I kind of wear two hats, but that gives me a little bit different perspective on the person that would come to see me to do these types of procedures. And what I want to talk about at the beginning of the show today is Botox, botulinum toxin A. Botox is a brand name for botulinum toxin A. It is manufactured by Allergan, which is a company based in America. Allergan makes a lot of different products for the eye, and Botox is been around for almost 25 years. It is a product that actually comes from a bacterium, and the bacterium is reprogrammed by genetic manipulation to make the Botox. So it actually doesn't come from a spore, a botulinum toxin spore. It comes from a bacteria that has been actually reprogrammed to be able to make this product, this toxin. Then it's refined, it's filtered, it's segregated, and bottled and shipped to us here at the office. Normally, the bottle comes in 100 units, and that is the cosmetic version. There's also a medical version that they produce that can be used for different medical issues, cervical dystonia, migraine headache, and other things like that. And that's, I believe, based purely on insurance, because insurance will reimburse people for those procedures. But cosmetically, no, that's not reimbursed by insurance, and typically that's paid out of pocket. We call fee-for-service. And our clinic is all fee-for-service. We accept no insurance, Medicare, Medicaid. And one day I'll talk about that type of clinic. But getting back to the topic, so Botox is a product that most everyone probably have had some experience with and hearing about in the news from a family member, maybe a loved one. It's done generally on people over the age of 20 and under the age of 70, although those are not totally exclusive. I have treated 24-year-old women that have hereditary forehead lines that are quite expansive due to the fact they just don't make a lot of sebum or skin oil, and they start to fracture their skin, which is basically a wrinkle, and that wrinkle is essentially a scar. And over time, those furrows develop, and people don't like that. When you move your forehead, you develop a movement in the skin, and that skin is attached to the fascia plane that is on top of the muscle, and that combination of skin movement along with muscle movement forms a wrinkle. You see it around the eyes, you see it in between the eyes, you see it on the forehead. You can also see it around the chin. And these are all skin issues that women and men find unappealing. So someone that I used to know in the field, professor, was shocked that, and this was when I was in training back in the late 90s, that this was going to be a multi-billion-dollar industry. And I think he was very prophetic in that, because it was not very popular when I was going through my training. It was very much around and people would do it, but that was really not a common thing that most people came in contact with in kind of a normal doctor's visit. Now it seems that the dentists do it, every kind of doctor, whether it be a oral facial maxillary surgeon to a ophthalmologist, dermatologist to a general practitioner, even nurse practitioners are doing this on their own. So it's very, very ubiquitous. It's everywhere, and that's really impressive that it's become such a cottage industry. Getting into a little bit more of the nuance, there are different ways on the application, And typically it's injected with a small needle and a syringe, and it's given in a dilutional state, and they're called units. And typically a face of, say, a 40-year-old male might require 50 units, and the face of a 40-year-old female might require 30 to 40 units. So there is a variance, and it depends on the thickness of skin and on the texture of skin as well. Normally, the way that I do it, I have a Juva pen, which is made in Switzerland. It's a small device that really is quite elegant, and it delivers a very small amount of material on basically demand. So I push a tiny little lever, and that syringe attached to that pen, it's actually a mechanical mechanism, allows the expression of that aliquot, or that small droplet of Botox, into the tissue. And I can control exactly how much I'm giving and the depth. And that's important because it's less painful, it's more accurate, and it delivers a much better result. I also do it by hand. I don't always do it by hand, but giving injections by hand is not necessarily bad or worse. It's just not as accurate, and it doesn't have the same effect, in my opinion. And I think that there are a lot of people that don't know about the Juva pen, but I really do like it. Now, related to timing, I'll ask Sophia what she thinks about this, how often people should get it. Normally, people are getting it every 3 to 4 months because it wears off after about that period of time. Sophia, how long do you think people should wait until they get it?
I honestly think it depends on the results they want and how they feel about it, because some people want more drastic results, so they would get it more frequent, and other people want to take their time with it or might not want such a drastic result. So it just really depends on the person.
Yeah, that's about right. Most of the time I find that people will either be in two camps. They'll either be very precise about when they want it done, because once they start to see lines, they immediately call for an appointment. And others may wait and let the Botox completely wear off and kind of live with a diminished look of lines and wrinkles, and yet not necessarily be so reflexive. There is an interesting point. If you do it too often, you can develop antibodies to the toxin. So if it's being done, say, every 3 months versus every 4-5 months, you might have some insensitivity to it down the road. So there is that caveat. But yeah, I think it's interesting because the typical person comes really with the idea that they want to look younger. They're not even sure what Botox is or how it works, and normally I'll educate them on that. And they will get confused sometimes and think that Botox is like a filler, or a filler is a Botox. There's this kind of sense of everything that you inject in the face is more or less the same. Botox works as a paralytic. It paralyzes the neuromuscular foot plate, basically attaches the nerve to the muscle. So that toxin breaks up acetylcholines, which is a neurotransmitter, breaks up that ability to communicate to the muscle. So the muscle doesn't react when you try to move it. And quite simply, you paralyze your face. And everyone's seen in Hollywood people that look overly paralyzed. Sophia, you've seen people in Hollywood like that, right?
For sure. A lot of people overdo it because they really just don't know what it's doing to them.
Mm-hmm. That's right. Yeah. Yeah. There's like a sense that more is better. And there are doctors that will do that. But yeah, the idea is that you want to deliver a reduced amount of movement to the face, but look as more or less natural as you can. And they've done studies where they show that decreases about 5 to 6 years off your age. And it's pretty consistent with studies that they've done in Europe and here in the US. So it does make you look a bit younger. It does prevent line formation, so you don't make the wrinkles, you don't make the lines over time. They in fact become less and less. And there's different regions on the face that you notice where these lines are. So you have the forehead horizontal lines. You have the mid forehead, which is called the glabella. You have those furrows, are called the 11s. And then you also have the lines around the eyes. And those are called crow's feet. And those are also technically called rhytids, which is a Latin term, but typically crow's feet's fine. So crow's feet, the 11s, and these horizontal furrows are the things that people don't like. And Botox works for that quite well. As I mentioned before, 30 or 40 units for a woman at the age of 40 is probably about right, and a little bit more for a man just because of the texture and thickness of skin. One of the other things that's interesting, some women have noticed as they get older, they develop some dimpling around their chin. And that dimpling is called peau d'orange. It is a French term, but it's the skin of the orange, essentially, and it looks dimply. And a lot of doctors don't even know about this area to treat, but you can treat that and make that dimpling much, much less and much more refined, so it's not as strong when they smile or they make a face. And it's typically when you'll see it. Also, you can inject around the mouth for people that have a gummy smile. So sometimes their retraction of their upper lip exposes much more gum than they would necessarily want. So that can reduce the amount of that gummy smile if the area just on the top of the lip where the skin is called the philtrum. If we inject that area, sometimes we can reduce the look of that particular issue. Outside of that, we don't really inject much more of the face. There are smile lines that look like cat whiskers, and sometimes we'll inject those areas, but it's very difficult to make those lines go away. Now I'm going to get into fillers, and the reason why I segue into that is because I'll use fillers and Botox to get rid of lines on the forehead and even around the eye. Fillers are completely different, and they are what you hear about when people have their lips done or people that have cheeks or things like that. They're actually products that cause water to congregate. So they're hydrophilic. It's a substance called hyaluronic acid. Hyaluronic acid basically causes a molecule water to attach to it, and in doing so, it hydrates that area of the tissue, and it makes the tissue plumper. That's simply how it works. And the more you add, the more water can be attracted to it, and the more plump or fullness you get in that area. Now, typically speaking, there's different types of products. I use, again, Allergan's product. I use Juvederm. Juvederm is the line, and there's Volbella, Voluma, and Juvederm XC. And I use all three for different areas. Depends on what I'm trying to achieve. With the lips, I find that most women, including some men, want to improve the way that their lip looks over time. As we get older, we lose tissue fullness, and the lips are one of the areas that can occur. So men and women both lose their lip substance as they age. So adding a little bit of hyaluronic acid or Volbella to the lip can cause the lip to expand and fill out. And actually, not only water is attracted, but it also can stimulate collagen formation. So that's an interesting facet. You can actually generate collagen in the area where we inject. And collagen is a substructure of skin. So there's collagen, elastin, hyaluronic acid. Hyaluronic acid is part of our natural skin. So we're adding something more or less that is somewhat natural to our own body, and that's why it's not rejected. In relationship to the forehead, there's the glabella, which I mentioned before, that forms the 11s or the furrow lines, makes people look angry, especially women, and that's not a good look. So I will use Botox to relax the glabella muscles, which are procerus and corrugator. Those two muscles form the movement of the glabella. If I inject that area with Botox and then I fill in the furrows with Voluma or Juvederm XC, I can make those lines almost go away. And I found that even in doing that once is sometimes enough. And I've had people come back 4 or 5 years later and I've only treated them once and those lines have not come back. They may have lines, but those deep furrows are gone. And it is pretty amazing. So you're reducing the activity of the muscle at the same time you're injecting, so you're allowing the body to recreate some collagen and fill in those lines. And that's pretty impressive. What do you think about that, Sophia?
I mean, it really depends on the person, what they're looking for. If they want no lines, then that's definitely the way to go. And it sounds like filler is definitely a healthier option than Botox just because of the collagen formation. But it honestly depends on the person.
Yeah, I would agree with that. I would agree that there is some question of, is Botox really safe? Well, that's a good question. And are fillers safe? Fillers seem to be very safe. There are indications where fillers can be contraindicated. So, being that someone being pregnant or someone having an infection in the face, acne, perhaps, or even having some reaction to fillers, even in the past, they can create a problem. There's some people that are allergic to fillers, but by and large, they're very safe. There's a safety profile to them that has been studied that shows that it does not cause any downstream problems or upstream problems, and meaning that it doesn't have a knock-on effect later on throughout your life. Botox, we do know that Botox can go around the entire body, it can go into the brain. We don't give it when someone's pregnant. And we surely don't give it to someone that has certain diseases, especially neuromuscular types of diseases and diseases like MS. We don't use it on those kinds of patients. But by and large, they're more or less pretty safe. I don't think that in the last 30 years of Botox being studied, there's anything that indicates that it causes any sort of brain disorder or problem that would be attributed to the use of it. So back to fillers. Fillers are very, very simple. It's an injection of hyaluronic acid, which is a gel, into the skin tissue. It can be deep or shallow. It can be used in small amounts or large amounts, depending on what we're trying to achieve. Typically, I don't use any more than a syringe on the lips, which is about 1 ml amount. In essence, there are different amounts that people will use. I use mild amounts of material in the cheeks. I use Voluma for that, and I can cause the area around the zygoma, which are the cheekbones, to be a little bit more accentuated, or I can use that in the temple. Adds a bit of volume and causes a depressed area around the face to fill out. In the lip, we use different types of needles. I have a different technique than probably most people. I go outside of the lip, not always into the lip. I don't use a cannula. I do use a needle. Cannulas are much more destructive on the lip. I use cannulas around the eye, and I can get into that in another discussion. But anyway, the idea is one of the most important things is to respect the tissue planes and not cause damage. So when you inject with these materials, I'm very careful not to cause a hemorrhage or some disruption in the tissue that causes bleeding or disfigurement of the tissue, which then has to be massaged down. You go very slow with the injection and you don't push it beyond a certain point, and then you can go back, and if you want to add more, you can. So it's better to add what you think's appropriate at the time. You can always add more. You can't take away. Although you can take away. You have to use hyaluronidase, which is a enzyme to break up the material. But neither here nor there. We're always trying to be careful with our products and educate the patient, and knowing more or less what they're receiving and how it's going to affect them, and the importance of using the proper material, the proper depth of tissue, and that can have a huge impact on the outcome and the look that we're trying to achieve. I don't like anything unnatural, and I'm very respectful to the face and natural lines of the face. So everyone's face is a bit asymmetric, and there can always be some changes in the cheek or around the eye that we can perceive. Even a couple of millimeters of difference is enough to see an eye a little bit up or down compared to the other one, or a cheek in or out. And those things can be modulated with some of these products too. So that's nice to have if you have a bit of a more asymmetric face than, say, someone that you'd compare yourself to. Anyway, I think that's a pretty good primer for understanding Botox and fillers. Pricing is pretty standard for these things across the board. People charge by the unit. I normally charge $500 for Botox procedure, more if it's going to require additional material. Fillers, it depends on the area. I charge $500 to $700, so more or less in that range. In Hollywood and in New York, people are paying 3 times that, and that's just because of the environment they're in, and some of the doctors charge much more. It just depends on who you see, but I try to make it reasonably priced, and I use only Allergan products primarily. In the clinic, I do use some other products that are not made by Allergan, but typically hyaluronic acid and Botox come from Allergan. So we use the very best products. We try to give the very best price, and we try to do the very best we can in providing the outcome. And that's why we've been in business for 15 years. And I think our patients are happy with their treatments and how they view themselves. So we always are here for you. And if you have any questions or you want to call us to make an appointment, you can. You can reach us at 305-672-4733. And you can email us at clinic@halllongevity.com. That's clinic@halllongevity, HALLONGEVITY.com, or visit us at www.halllongevity.com with 2 L's. And we're happy to answer any questions or make an appointment, give you a free consultation if you'd like, and be able to give you some very important data if you do want to understand your own face. And I can do that with about 10 or 15 minutes. I do an assessment, and I can sketch out what I think is important and give you what I believe might be a approach to looking younger and feeling better about your face. Thank you so much.